The National Antimicrobial Resistance Monitoring System, or NARMS, is a public health surveillance system that began in 1996 to help measure how antibiotic use in food animals affects human health. What's really cool about this is that NARMS uses an integrated approach to track antibiotic resistance in foodborne and other intestinal bacteria from 3 sources: sick people, food animals, and meats from grocery stores. Measuring antibiotic-resistant bacteria from these 3 sources allows us to identify how antibiotic-resistant bacteria flow through the food chain to people. NARMS is a partnership among the Centers for Disease Control and Prevention, the U.S. Food and Drug Administration, the U.S. Department of Agriculture, and state and local health departments. Surveillance data from NARMS can be combined with other public health data to give us useful information about how resistant infections differ from other infections. This helps us measure whether steps to limit the spread of resistant bacteria are effective.
NARMS is a collaboration among state and local public health departments, the Centers for Disease Control and Prevention, the U.S. Food and Drug Administration, and the U.S. Department of Agriculture. NARMS scientists combine data from sick people, animals, and meat to determine sources of antibiotic resistance.
Through NARMS, experts track antibiotic resistance rates and study changes in antibiotic resistance patterns among several types of bacteria transmitted commonly through food. Studies using NARMS data increase our understanding of resistance trends over time, new or emerging resistance patterns, what resistant bacteria are making people sick, and which groups are at risk and why. Many stakeholders use NARMS data to help guide efforts to protect people from resistant infections. Stakeholders include federal regulatory agencies, policymakers, consumer advocacy groups, industry, and the public.
NARMS helps protect public health by providing information about emerging bacterial resistance, the ways in which resistance is spread, and how resistant infections differ from other infections. The CDC NARMS laboratory tests samples of bacteria that cause food and water-related infections in people across the United States. The laboratory uses antibiotic susceptibility testing to measure whether specific antibiotics are able to kill the bacteria. And this part is really cool. Scientists expose the bacteria to different concentrations of antibiotics to see if the bacteria will grow. If the antibiotic does not kill the bacteria, or if a really high concentration of the antibiotic is needed to kill the bacteria, it means the bacteria are resistant. The laboratory can then determine why the bacteria are resistant to that antibiotic at the genetic level. In other words, identify the changes in the bacteria's DNA that made it resistant. The NARMS laboratories at CDC, FDA, and USDA all identify what causes bacteria to become resistant to antibiotics and also study how the DNA that causes resistance is spread to other bacteria. The CDC NARMS laboratory also tests bacteria from outbreaks for antibiotic resistance. Knowing which antibiotics the bacteria are resistant to and which resistance genes the bacteria contain can help investigators identify the source of an outbreak.
Over the last 20 years, NARMS partners have collected antibiotic resistance data on Salmonella, Campylobacter, and other bacteria transmitted commonly through food to detect emerging antibiotic resistance and monitor trends. NARMS studies have contributed significantly to our understanding of resistant intestinal infections and how antibiotic-resistant bacteria flow through the food chain to people. NARMS data have been used to provide information for regulations and policies related to antimicrobial drug approvals in food animals. Public health agencies also use NARMS data to set up and study the effectiveness of programs to reduce antibiotic resistance and improve antibiotic stewardship. NARMS is essential in our efforts to combat antibiotic resistance.
New technologies, such as whole genome sequencing, present remarkable opportunities for expanding NARMS surveillance. Whole genome sequencing allows us to look for all the genes known to cause antibiotic resistance. We can then compare resistance genes found in the bacteria coming from people, from meats we buy, and animals, to show which resistance genes come from which sources and help identify the sources of bacteria that make people sick. Whole genome sequencing lets us track antibiotic resistance patterns over time and follow trends more effectively. It will also help us find more outbreaks due to resistant strains so that they can be stopped.
Whole genome sequencing is a laboratory process that determines the sequence of all the DNA in a bacteria with one test, similar to a fingerprint. Whole genome sequencing determines the order of all the bases contained in an organism's DNA. If we know the whole genome sequence of a bacteria, we can find the genes that make the bacteria resistant to antibiotics. NARMS laboratories use antibiotic susceptibility testing to identify the drugs that bacteria are resistant to and then to help determine the genes responsible for antibiotic resistance. NARMS scientists are now taking this further by using whole genome sequencing to look for resistance genes. This new technology is more advanced and efficient than previously used methods. It allows scientists to test more bacteria, including bacteria that could not otherwise be tested using traditional antibiotic susceptibility methods. NARMS scientists can predict antibiotic resistance based on the genes found in the whole genome sequence. Whole genome sequencing allows public health officials to rapidly detect genes that make bacteria resistant to antibiotics. This work will help scientists target interventions to reduce the number of people affected by antibiotic resistance and prioritize investigations of outbreaks caused by antibiotic-resistant bacteria.
For 20 years, the NARMS Collaborative Program has brought together the FDA, CDC, and USDA to provide the best scientific information about antibiotic resistance in the food supply for policymakers and practitioners. As a result, new problems have been identified and some of them have been controlled. Other problems continue but have not increased as much as they would have. NARMS is a critical platform for the public health community and the animal health community going forward to identify and manage antibiotic resistance problems in the future.